Angelica Shi Zhi, Spurb.
Hello and welcome to episode 73 of Spurb's Herbs. Today we're going to be talking about Chinese herb Shi Zhi or Shi Zhi. 3 different tone marks there, all on eyes. And the Latin here is Halloysitum rubrum, or the common name is Halloysite or Kaolin. So, we'll talk about that in just a minute, but let's get into it. So today's episode, we will be exploring an interesting Chinese quote-unquote herb, Shi Zhi, or Halloysite or Kaolin. This mineral is in the Chinese medical category of herbs that stabilize and bind and can be used in a wide variety of conditions, including chronic diarrhea, uterine bleeding, and chronic sores. And as usual, we will be exploring something a little different. We are going to discuss an important area of practice, one that is near and dear to me, proper charting. Please stay tuned for this intriguing episode. Before we get into that, did you know that I have written a couple of books? The first book is Integrative Pharmacology, combining modern pharmacology with integrative medicine. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it is also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the same page. It's not only a great book explaining pharmaceuticals, it is also available at an amazing price. It is available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy-to-digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it is also 10% off and signed by one of the authors, me, all for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com, SPERBSHERBS.com. Okay, so I teach a course called Protecting Yourself Through Proper Charting, available at https://integrativemedicinecouncil.org/product/proper-charting. So that's how to find it. You can just find it. Go to the courses on integrativemedicinecouncil.org. In this course, I do a deep dive in how to do proper charting for acupuncturists and Chinese medical practitioners. Having been a clinical supervisor, director of clinical services, college dean, subject matter expert for legal cases, and accreditation site visitor, I have examined thousands of chart notes across dozens of schools, and I am on a bit of a crusade to promote good charting to protect our profession. With that in mind, I would like to introduce some basic concepts of charting today. Charts are usually created using the SOAP or SOAPy system. SOAP stands for Subjective, Objective, Assessment, and Plan. Some venues are adopting SOAPy, or SOAPE, style notes, which emphasize the education function of the medical profession. E may, on some variations, also mean evaluation and be used in the acronym SOAPy, which is IE, so SOAPIE, and SOAPier, SOAPIER, where intervention and revision are also added in. SOAP style notes, the basic SOAP style notes, are the standard for charting. So I want to tell you a true story that happened to me. So I was working as a supervisor. It was a young supervisor. It was probably my first 1 or 2 semesters working as a clinical supervisor at a school clinic shift in the afternoon. And what happened was the patient was passed on to me from the morning shift. They had been working on her and she couldn't get off of the table. And the supervisor needed to go. And of course, the students needed to go. Their shift was over. So the supervisor asked if I'd take it over. Now, I was new to this. In Western medicine, in the hospital, as a medical student, you are always handing off and accepting patients. So it's no big deal. I didn't realize how odd it was that I was being handed a patient as an acupuncturist at that time. So tried to get her off the table. She couldn't get off the table due to spasms in her low back. And I worked on her for maybe 2 hours doing needling and cupping and I don't know what else I did. I did a massage, did a lot of stuff on her, and she still could not get off the table. And then I remembered I was wondering, one of the instructors I had as a master student at the school, but then also moving on, he was still teaching there, and he was a chiropractor. And I wondered if he was on campus. I looked around, he was. And I went up to him and I asked him if he would mind seeing this patient. He very graciously said yes. And he came in and he saw the patient for about 5 minutes and had her up and walking soon thereafter. So within 5 minutes, she was up and walking. She was still in pain, but was able to get around. And after that, I'm thinking, okay, this patient's been here for 3 or 4 hours. This is a potential malpractice case. I want to make sure I get really good notes. So I went up to the chiropractor. He had gone back to class as soon as he got the patient up. Really, all it was to get her past the initial pain, and then everything kind of fell into place and it was fine. But I was new, and when you're new, you're a little bit afraid to go through that pain. So it was good. So I went into the classroom where he was prepping, and I asked him if he'd write a chart note for this case. He ended up spending about 20 to 30 minutes writing a note for a patient he saw for no more than 5 or 10 minutes. And I looked at it. It was small print, both sides of a page. And I said, wow, this is a huge note. Why did you spend so much time on this note? And he replied, Greg, I have been sued for malpractice twice in my career. Both times, the other lawyer saw how thorough my charting was and dropped the case. And that's what the power of a good charting is. Again, I've been a subject matter expert on several cases now, both sides, plaintiff and defendant. I've seen them all. And the charting sucks universally in all these cases. And I'm trying to defend an acupuncture. It's hard for me to do that sometimes with what's in the chart notes. On the other side of it, it's really easy for me to go ahead and try to say that there's something wrong because the chart supports that there is something wrong. So what are some of the general issues with charting? So the first big issue is using the word normal. And I taught this. This is something that I taught in school. So I've had hundreds of students writing, each of them writing in 10 chart notes, big, thorough chart notes. It was my exam class, my physical exam class. And I can't tell you how many times a student would say normal. They would say, oh, elbow, normal. I'm like, what? What does normal mean? Example of this is blood pressure. Normal could be defined as below 130/85, which is sort of the current definition, or it could be the old definition of below 140/90, or it could be normal for this hypertensive patient at 160/105. And when does blood pressure become too low? So what does normal mean? Generally, using normal is most commonly just a shortcut that means nothing. The bottom line is saying normal is a diagnosis that in all likelihood is not substantiated. Other points about using normal include, instead of normal, use actual findings from exams. Don't say heart sounds are normal. Say heart sounds are dual, lub-dub, with nil or nothing added. If actual findings are too complex when there are no abnormalities, or to wrap several exams into one finding using the acronym NAD, or no abnormalities detected. You can use no abnormalities detected. This is the opposite of a diagnosis because it basically says, hey, I didn't see anything wrong, but that isn't to say there isn't something wrong. There are other acceptable acronyms such as WNL or within normal limits. Now, as soon as I say in class that you can do NED or WNL, then instead of normal, everyone just says NED and WNL. No, those are last resorts. Always, always, always. First thing is to do your actual findings. So don't say elbow NAD or elbow WNL. No, you say you do an exam of the elbow. You talk about what you see. You see that there's movement is normal, that they're within normal limits, but then you go on and you say the range of motion was between this and this, and there was no crepitus, and you explain what your findings actually are. And again, remember, actual findings are always better than a generic acronym. Other words to avoid that are similar to normal include okay and nothing. As soon as I say you can't say normal, my students will always go okay, and they'd write okay, or nothing. I don't know what nothing means, but they would put nothing. An exception to these rules are words that come straight from the patient. In this case, it is a quote and should have quotation marks around it. Other issues, general issues with charting is don't mix up history exam and investigations, or by the same token, subjective, objective, and assessment. Common ways this will happen is within the history of presenting illness. When describing the chief complaint, exam findings are mixed in. For example, the patient complains of pain in the leg 4 centimeters below the head of the fibula and just anterior to the fibula. History would be the patient has pain on the side of the leg below the knee. Later would come the exam findings describing exactly where the pain is. Remember, history is from the patient and is subjective and generally inexact. Exam findings are from the practitioner, objective, and should be very exact, including to the point where there are measurements. You should, I'll be the first to admit I used to, but I don't anymore. I used to carry around a measuring tape with me so I can measure things. I don't do it anymore, but I should. It was handier nowadays. I usually work in scrubs, and back when I was in the clinic at school, I would have a lab coat, so it was easy just to keep the tape measure in my lab coat, just have it always there. Investigations are lab tests that are ordered by the practitioner and could include x-rays, an MRI or CT scan, or blood work. Generally, we don't do investigations. In California, we're allowed to in our scope of practice, but it's not done regularly, and insurance companies may or may not pay for it, so we generally don't. The exception here is that investigations ordered by other practitioners are often included in the history of presenting illness. The biggest issue in regards to malpractice and insurance charting is not being thorough. The goal here is to answer all questions a reader of the chart may have. The best medical writers do this very succinctly in a small amount of space, but it is best to err on writing too much rather than too little. The first person should not be used in a chart. In a standard history exam, the first person, using the words I, me, my, mine, mine, myself, we, us, ourselves, etc., is forbidden. Of course, the exception, once again, is a quote from the patient, which should be in quote marks. All right, this is just an introduction to charting and some of the common issues that can come up. If you want to know more, you have that course that I have. It's a 2-hour course. We get into this in pretty big depth. But with that we've talked about, let's get into today's herb. Today's herb is Shi Zhi, or Halloysite, or Kaolin. Family, or in this case, mineralogical classifications. Usually I talk about the family of the herb, and this is not an herb, it's a mineral, so its classification is it is considered a sheet silicate mineral. And again, species, there's no species here because it's not alive, or the standard substance, and that standard substance is halloysite, or in Chinese, duo shui gao ling shi. English translation of Shi Zhi is crimson stone resin, or red stone resin. Other names include red halloysite, Qi Tu, Hong Gao Ling Tu, Hong Gao Ling, Shi Tu, Hong Tu, Shi Tao Tu. In Japanese, it's, again, I don't speak Japanese, so please forgive me, Shaku Kusakushi. And in Korean, same warning, Jok Seokji, something along those lines. Bensky and their team. Remember, we use 3 major textbooks. One of those is Bensky and his team. Say the dosage is 9 to 18 grams. Chen is another one of our textbooks. And Brown and Wiseman is our third one. And both of them, Chen and Brown and Wiseman, say the dose is 10 to 20 grams. So very similar. So Bensky tends to go with a little bit more traditional using 3s, so 9 to 18. While Chen and Brown Wiseman are a little bit more modern, and they tend to go by 5s and 10s, so they go 10 to 20 grams. So basically similar dosages between all the books. Silicate minerals. Let's talk about those sheet silicate minerals as sort of the family. We always get into the family at this point. Silicate minerals are rock-forming minerals made up of silicate groups. They are the largest and most important class of minerals and make up approximately 90% of Earth's crust. Phyllosilicates, or sheet silicates, form parallel sheets of silicate tetrahedra with silicate oxides, so it's 2 silica and 5 oxygens, or 2 to 5 ratio. All phyllosilicate minerals are hydrated, which means there's water with either water or hydroxyl groups attached. Halloysite is a member of the clay minerals group of phyllosilicates. Category, so coming off of that sheet silicates back into the herb. Category of this herb depends again on which textbook we're using. Bensky and et al. Put this herb in the herbs that stabilize and bind category. There are no subcategories here, except Brown Wiseman does have subcategories. But Chen and Bensky do not have subcategories. So Bensky says stabilize and bind. Chen say it is in the astringent herbs category. Stabilize and bind, very similar to astringent. I think those are basically synonyms. And Brandon Wiseman says it is a diarrhea checking medicinal subcategory under the astringent medicinals category. So they do have the same category overall, but they have these sub categories, which the other books do not. So it puts it in diarrhea checking medicinal. Bensky and their team say it is sweet, sour, astringent, and warm temperature, and enters the spleen, stomach, and large intestine channels. Both Chen and Brown Wiseman agree, but do not include the spleen channel. So it's just the stomach and large intestine channel. And Brown and Wiseman do not believe it is sour. So Chen and Bensky both say it's sour. Brown and Wiseman says it is not sour, which is interesting because sour is actually the astringent taste. So of all the tastes here, sour should be the one that sticks, but okay. That's why we do this. We love the discrepancies between these books. The Divine Farmer's Materia Medica. So every time I have to introduce the Divine Farmer's Materia Medica, the Shennong Ben Sao Jing, this is the first existing book on single Chinese herbs. And it was written around 200 CE, so early on in Chinese herbalism. And the Divine Farmer's Materia Medica says it is sweet and balanced temperature. So they don't include sour either. It also says there are actually 5 colors of halloysite, and each color corresponds to its appropriate viscera. In this case, that means Shi Zhi, being red, should affect the heart and small intestine. We're actually going to see that mentioned when we talk about the commentary on this herb. And the history, pretty straightforward. The history, we're like looking at when was this first mentioned, and both Bensky and Chen, Bensky and his team, and Chen say the original source for this herb is the Shennong Ben Sao Jing. There are no individual herbs that are before the Shennong Ben Sao Jing in Chinese thought. So Shennong Ben Sao Jing are the Divine Husbandman's classic of Materia Medica in the 2nd century CE, as I mentioned. I said 200 CE, 2nd century, so anywhere from 100 to 200 CE. Let's talk about these herbs that stabilize and bind. So Bensky always has a really good introduction to these categories, and they do here as well, Bensky and his team. The herbs in this category are used primarily for treating disorders in which bodily substances are discharged abnormally or structures within the body slip from their proper positions. Such disorders include diarrhea, urinary frequency, excessive sweating, vaginal discharge, miscarriage, and prolapse of the uterus or rectum. All of these can be viewed as forms of excessive dispersion, san, and require herbs that stabilize, gu, or bind, sa. These types of disorders are usually associated with weakness due to chronic disease or old age, but can also arise from iatrogenic causes, such as improper use of purgatives or dispersing substances. Note that a weakness of primal qi predisposes one to these problems and is further injured by these types of leakage and slippage. While most of the herbs in this category are sour and astringent, they serve diverse functions. Some are best used for stopping sweating, others for stopping diarrhea. Another group is used primarily for treating polyuria or abnormal discharges from the lower burner, including leukorrhea, white vaginal discharge. And a fourth group is very effective at stopping coughs. Consistent with the idea that herbs which stabilize and bind are those which keep fluids in, some of the substances in this category are also used to control bleeding, particularly from the uterus. It is important to bear in mind that herbs that stabilize and bind only treat the manifestations of a disorder. To be useful, they must be combined with other herbs that treat the root cause of the disorder, which is most often a form of deficiency. Because it is the nature of these herbs to retain and bind, they are inappropriate for treating cases where an external disorder has not fully resolved or where there is an internal stagnation of dampness or heat from constraint. The use of these herbs in such situations may prolong and possibly aggravate the underlying disorder. Chen and Chen say the following about astringent herbs. Qi, blood, jing or essence, and jin ye, body fluids, are bodily substances essential to health maintenance. In the normal course of life, these four substances are continually produced and consumed. Maintenance of health requires the level of production to be equal to or greater than that of consumption. When consumption exceeds production, organ function is compromised, leading to deterioration of overall health. This imbalance must be treated as early as possible to restore normal balance. If not, the condition will continue to deteriorate, leading to deep deficiency. While tonic herbs are often beneficial in the initial stages of deficiency, they are not as useful in chronic situations, as the patient is often too weak to metabolize tonics and will be unable to benefit fully from the tonic substances. In such cases, astringent herbs are prescribed to prevent further loss of these four vital substances. Sour in taste, astringent herbs enter the heart, lung, liver, kidney, and large intestine to bind, retain, and prevent the loss of valuable body fluids and other substances. They are often prescribed for patients who have chronic illnesses with profound deficiency and inability to hold fluids within the body, leading to leakage. Clinical indications for use of astringent herbs include profuse menstruation, perspiration, diarrhea, coughing, spermatorrhea, nocturnal emissions, frequent urination, and bleeding. It is important to keep in mind that while astringent herbs prevent the loss of bodily substances, they do not intrinsically restore normal balance. Therefore, while astringents can be used in patients with chronic illnesses, they should not be used on a long-term basis. Clinically, they should first be used for a short period of time to stop further losses in chronic illnesses. When the condition stabilizes, differential diagnosis must be made again and appropriate herbs be prescribed. That is, once stable, patients with spontaneous perspiration due to qi deficiency should be treated with qi tonics. Patients with loose stools and diarrhea due to spleen and stomach deficiencies must be treated with spleen and stomach tonics. And patients with frequent urination and incontinence associated with kidney deficiency must be treated with kidney tonics. In short, for adequate treatment, use astringent herbs to ease the urgency of the condition, then use tonics to treat the underlying causes of the disease. As astringent herbs function to bind and restrain, the use of such herbs will keep any pathogenic factors within the body. Therefore, astringent herbs should not be used in conditions characterized by the presence of pathogenic factors inside the body, such as perspiration due to febrile disorders, food stagnation with diarrhea, profuse menstrual bleeding due to heat in the blood, or frequent urination due to heat in the lower jiao, lower burner. So that's commentary on this category of herbs. So what is good quality of the Shi Zhi? Bensky and his team say good quality consists inside and out of homogeneous, flesh-colored, pink, glossy, and soft pieces without any foreign mineral matter. Our usual text on the quality of herbs, Chinese medicinal identification, illustrated approach, does not have an entry for this herb. So usually it's pretty good, but not today. So what does it do with Chinese medical actions? According to Bensky et al., Shi Zhi binds up the intestines and stops diarrhea. For chronic diarrhea due to cold from deficiency or chronic dysenteric disorders with mucus and blood in the stool. Usually diarrhea is chronic and is often accompanied by undigested food in the stool. It also contains the blood and stops bleeding. For uterine bleeding, excessive menstruation, blood in the stool, and bleeding prolapsed rectum due to cold from deficiency of the lower burner. Also used topically for bleeding due to trauma. And finally, it promotes healing of wounds, used in ground form and applied topically for chronic non-healing ulcers, also used topically for weeping damp sores as well as prolapsed rectum. Chen say it binds the intestines and stops diarrhea for chronic unremitting diarrhea or dysentery, rectal prolapse. It also stops bleeding and uterine bleeding and leukorrhea, and promotes healing of sores and ulcers, including chronic non-healing ulcers, weeping damp sores, or bleeding. And Brandon Wiseman say it astringes the intestines and checks diarrhea, staunches bleeding by astriction, and closes sores and engenders flesh. Finally, the Divine Farmer's Materia Medica says it is a superior class herb and it mainly treats jaundice, diarrhea, and dysentery, intestinal afflux with pus and blood, that would be dysentery, genital erosion, precipitation of blood, red and white vaginal discharge, evil qi, welling, abscesses and swellings, flat abscesses, hemorrhoids, malign sores, head sores, and itching scabs. Protracted taking may replenish the marrow, boost the qi, and make one fat and strong, free from hunger, and the body light while prolonging life. Remember, superior class herbs are designed to be taken more commonly and have these usually more beneficial effects, long-term beneficial effects. So that's our Chinese medical actions here. Let's talk about different ways to prepare it. So Bensky et al. Has a single entry on this herb's preparation after a really extensive overview of this herb, how to prepare this herb. The substance resembles kaolinite in that both are clay substances which are similar in composition, both being hydrous aluminum silicates. Kaolinite is also known as kaolin or China clay, long used medicinally in treating diarrhea as an ingested absorbent powder, which it is suggested binds and inactivates poisons that may be in the intestines. Kaolin is also used for industrial purposes such as porcelain and the manufacture of coated paper. In their pure form, both halloysite and kaolin are white in color, and although in contemporary times the reddish-colored clay, crimson stone resin, or Shi Zhi, is preferred for medicinal use in Chinese medicine, Shi Zhi noted that the properties of the various colored stone resins, Shi, are basically similar. He did say, however, that regarding the white and crimson color, the white enters the qi level, while the red enters the blood level. This substance is quarried, cleaned of extraneous material, and the red-colored clay, which is slippery and greasy like resin, is then collected. When wet, it gives off the smell of fresh clay, and being quite absorbent, it sticks a bit to the tongue when licked. Without further preparation, it is known as unprepared halloysite, or sheng Shi Zhi. Sheng means fresh or unprepared, and is sweet, sour, astringent, and warm with a strong ability to restrain dampness and generate flesh. In this form, it is often applied externally for chronic ulcers that fail to heal over or for bleeding from wounds. And that brings us to the one preparation, which is calcined halloysite, or duan Shi Zhi. The substance is mixed with vinegar, rolled like dough, then cut into sections. These are placed inside a calcining container, then heated until red hot in a charcoal fire. Prepared in this manner, it is sweet, astringent, and warm. Its restraining and inhibiting nature is enhanced, and its ability to stop bleeding, vaginal discharge, and diarrhea is increased. The calcined form is generally preferred for internal use, although the raw form is used in some places in decoction. In either case, it is best placed in a cotton bag before decocting. So what are the Western uses of this herb? It appears this herb is primarily a Chinese herb, and it was difficult to find any Western herbal entries for this herb. The PDR for herbal medicines does not mention this herb. And interestingly, there is some modern pharmaceutical uses for this material, which we'll discuss in just a few as we get into the science of this herb. Before we do that, let's talk about commentary. Bensky and his team always has an excellent commentary, and this herb is included in that. So let's get into it. Halloysitum rubrum, or Shi Zhi, is sweet and warm and thus augments the qi, heavy in weight such that it enters the lower burner, reddish in color such that it enters the blood level, and sour such that it stabilizes and binds. These characteristics also enable it to generate flesh and thus assist in the healing of chronic sores. It is also applied externally for this indication. Its main areas of application, however, are in the treatment of chronic diarrhea and uterine bleeding associated with deficiency disorders. Although because of its crimson color, the earlier Materia Medica texts associated this substance with the heart and with blood. In the Grand Materia Medica Ben Sao Gong Mu, written in 1590, Li Shi Zhi says that all 5 stone resins are medicinals of the hand and foot yang brightness channels. They are sweet and warm, heavy in weight, with an astringent nature. Astringent and heavy, they therefore inhibit dampness, stop bleeding, and stabilize the lower body. Sweet and warm, they augment the qi, generate flesh, and adjust the middle. The middle here means the intestines, stomach, flesh, muscles, palpitations with anxiety, and jaundice. The lower body means blood in the stool, dysenteric disorders, incessant uterine bleeding, vaginal discharge, and spermatorrhea. Li goes on to say that the separation of attributes by color in miscellaneous records of famous physicians, the Mingyi Bei Lu, circa 500, is rather forced, but of the white and crimson color, the white enters the qi level and the red enters the blood level. Li Gao says this medicinal expels retained placenta, but many commentators have disagreed, pointing out that this would require an ability to transform blood stagnation. Others suggest that Li was probably referring to women whose spleen and stomach qi is so exhausted following childbirth that they lack the strength to expel the placenta normally. For them, the warm sweetness of Shi Zhi can augment the qi and thereby assist in the elimination of the placenta. Chen Chen also has a short author's comments on this herb. Shi Zhi is historically used as a generic antidote to treat accidental ingestion of poisonous substances. It has a strong binding affinity. When it physically binds to another substance, the result is a large insoluble complex that cannot be absorbed through the gastrointestinal tract. The poisonous substance is then eliminated from the body via the stool with minimal systemic absorption. It sounds a lot to me like activated charcoal and how it's used to prevent poisons from toxic substances from getting ingested. So let's talk about some comparisons. Bensky and his team compares this herb with two others, Limonitum yuyuliang and Papaverus pericarpium or yingsuka. Seeking accuracy in the Materia Medica compares these three herbs. Halloysitum rubrum, Shi Zhi, Limonitum yuyuliang, and Papaverus pericarpium yingsuka are all remedies that restrain, bind, and stabilize conditions of abandonment. However, Papaverus pericarpium yingsuka is light in weight and slightly cold, with an action that enters the qi level and preserves the lungs, while Shi Zhi is sweet, warm, heavy in weight, and red in color, so that it enters the lower burner blood level to stabilize abandonment. It also closes up sores which have perforated and generates flesh. Limonitum or yuyuliang is sweet, neutral, and astringent, heavier in weight than Shi Zhi, and strictly binding in its effect. In terms of sedating and pressing down, the others are inferior to Limonitum yuyuliang. Thus, the warmth of Shi Zhi augments qi to generate flesh. Its sourness stops bleeding and stabilizes the lower body. By contrast, Limonitum yuyuliang only binds and has no ability to augment the qi or generate flesh. Papaverus pericarpium yingsuka is light in weight rather than heavy, which enables it to enter the upper burner, while it addresses the qi level of the lungs rather than the blood level of the lower body. So that's our comparisons today. Let's get into combinations. Bensky only has one combination, which is with the herb we just talked about with Limonitum yuyuliang. Because these two medicinals have similar actions, there is a synergistic binding and securing effect when they are combined. They are often used together for chronic dysenteric diarrhea with incontinence and incessant uterine bleeding without clotting. At the same time, the neutral nature of Limonitum yuyuliang modifies the warmth of Shi Zhi so that the combination can still be used in slightly warm conditions. Chronic is the primary indicator for using this combination, yet this remains a branch, not a root treatment. Other substances must be added to address the underlying deficiency. In some cases, however, the chronic diarrhea is not the result of deficiency, but is iatrogenic in origin. Iatrogenic meaning caused by something else that was. Iatrogenic means it's caused by something that was supposed to help. So in other words, a drug that causes another disease is called iatrogenic. Equal amounts, 30 grams of each substances are prescribed in the discussion of cold damage to Shanghanlong, circa 220. Formula Halloysitum and limonite decoction or Shi Zhi yuyuliang tang, which is designed for incessant diarrhea following repeated and improper downward draining treatments of the patient. So in other words, excessive purging. And that would be one of those iatrogenic causes here. According to Zhang Jing, who wrote on cold damage, Shanghanlong, discussion of cold damage, if it does not stop after administering this prescription, one should then facilitate urination. All right, that's the combination. Let's talk about the contents. There's some interesting contents here. So according to Bensky et al., the contents of this herb, quote unquote herb, include several inorganic materials, including silicate mineral, Al4, Si4, O10, and a in complex with 8 hydroxyl groups and 4 water groups. There's also iron, magnesium, manganese, and calcium. Halloysite is an aluminosilicate clay mineral with the empirical formula Al2Si2O5OH4. Its main constituents are oxygen, 55.78%, silicon, 21.76%, aluminum, 20.90%, and hydrogen, 1.56%. It is a member of the kaolinite group, as we mentioned. Halloysite typically forms by hydrothermal alteration of aluminosilicate minerals. In other words, hydrothermal means water, hot water. So that's the contents. I guess it wasn't that interesting, but it's there. The science is where it gets kind of interesting. According to Chen, the pharmacological effects of Shi Zhi include binding. Shi Zhi contains a large amount of aluminum silicate. Following oral ingestion of Shi Zhi, the aluminum silicate binds to and subsequently eliminates various substances present in the gastrointestinal tract, including but not limited to phosphorus, mercury, and bacterial endotoxins. It's also hemostatic. Administration of Shi Zhi may decrease bleeding time in rabbits. And they also describe a study with an N of 14, which is very small, which successfully used Shi Zhi in a formula for treating rectal prolapse. So lots of issues with that. First of all, N of 14 is not statistically valid, so don't care what it says, really. It was also used in a formula, so was it Shi Zhi or something else in the formula or the combination? And then in rectal prolapse. So interesting, maybe consider it like a pilot study going, okay, maybe it could be used in rectal prolapse, but a lot more evidence needs to be there before we can say, yes, it does. So here's the interesting stuff about the science here. So Sadish et al. And his team, or her team, discussed biomedical application of Shi Zhi. Halloysite nanotubes, HNTs, are naturally occurring tubular clay materials made of aluminosilicate kaolin sheets rolled several times. In other words, this is interesting. These happen naturally with this material. The aluminol and siloxane groups on the surface of HNT facilitate the formation of hydrogen bonding with the biomaterials onto its surface. Remember that we said that it kind of sticks to the tongue? That this is actually saying that there's hydrogen bonding. That's a weak form of bonding that may do that with our biomaterials. These properties render HNT pivotal in diverse range of applications, such as in environmental sciences, wastewater treatment, dye removal, nanoelectronics and fabrication of nanocomposites, catalytic studies, as glass coatings or anti-corrosive coatings, in cosmetics, as flame retardants, stimuli response, and forensic sciences. The specific properties of HNT also lead to numerous applications in biomedicine and nanomedicine, namely drug delivery, gene delivery, tissue engineering, cancer, and stem cells isolation, and bioimaging. That's fascinating stuff. So we're like just starting to learn how these naturally occurring halloysite nanotubes can play a huge role in modern science and medicine. Okay, let's talk about drug-herb interactions, which we always get into. Chen say Shi Zhi has a strong binding affinity, and when it physically binds to another substance, they form a large insoluble complex that cannot be absorbed in the intestines. Therefore, it is recommended that ingestion of drugs and this substance be separated by at least 2 hours to avoid interference with proper absorption. So again, this would be level D evidence. This is from an expert opinion. There's no evidence, actual evidence that this occurs. But again, this seems like a pretty straightforward thing that it could do. So I kind of agree with it, even if it's lower level. The one thing I want to mention with this advice, and I think I said it in a couple episodes back, there's this idea in our field. If I were to ask anyone in our field, how do you avoid drug-herb interactions? Probably 9 times out of 10, the response will be, oh, you separate the drug from the herb by a few hours. There's various ones. I've heard 1 hour, 3 hours, whatever. There's all kinds of different, but you separate the administration of a drug and an herb, and that will reduce the possibility of a drug-herb interaction. And that's not true. Absolutely not true. It can just as easily increase the chance of a drug-herb interaction as it decreases. It's far more complicated than that. But there are exceptions to the idea that it's not going to do this. This is one of those exceptions. If you take something that physically binds other things at the same time, then they can get physically bound and there could be an interaction that occurs. So I agree with this advice here, though in general, I don't agree with this advice for drug-herb interactions most of the time. But this is one of the exceptions to that. I did do a literature search on evidence of cytochrome P450 and P-glycoprotein interactions and didn't come up with any, so there weren't any obvious drug-herb interactions. And one of the books that I like to use here is the American Herbal Product Association's Botanical Safety Handbook, which rates herbs on their potential for an interaction as well as its overall safety, but it doesn't have an entry on this herb. So I was not able to actually look at this herb and say, according to the American Herbal Products Association, whether or not it's of concern or not for drug-herb interactions. But having said that, there are concerns about this herb. Bensky has quite a bunch of them. Bensky and their team note several concerns with Shi Zhi. Under the heading of cautions and contraindications, they say use with caution during pregnancy, contraindicated for hot diarrhea or in the early stages of dysenteric disorders, and for accumulation of damp heat from excess. Remember, this is binding, it's astringing, it's holding things in. So you don't want to hold in damp heat. That hot diarrhea is the same thing. You don't want to hold in the heat there. When it's hot diarrhea, you kind of want it out. And that kind of cools the body and it gets rid of it. And the early stages of dysenteric disorders, again, that would mean it's an infectious disorder and you don't want to hold in infections. So all of these are good reasons for not taking this herb. Under the heading of traditional contraindications, they say, according to some traditional sources, this herb antagonizes cinnamomum cortex or rogue. This is cinnamon, normal sort of our herb, the cinnamon you find in your closet. And I say that because more likely than not, you don't have cinnamon in your closet. You have something that's very close to cinnamon. But if you have real cinnamon in your closet, then this is rogue. Commentary on the Divine Husbandman's Classic of Materia Medica, the Shendong Ben Sao Jing Shu, written in 1625. So this is not the Divine Farmer's Materia Medica that we talked about earlier. This is commentary on that, which happened 1,400 years after that, the Divine Husbandman's Materia Medica came out. This commentary warns that before using astringent substances, most of the pathogenic influences that are causing the problem should be eliminated. So again, this is a branch treatment, not a root treatment. You want to make sure you're treating the root as you're going along. For example, this is continuing that thought from Bensky and his team. For example, if a vaginal discharge is completely damp heat, it should not be used. And the method for incessant uterine bleeding should be to tonify the yin and clear heat. One cannot totally depend upon binding and restraint. This book goes on to warn that in cases where the pathogenic influence has not been removed, quote, herbs to arrest and bind are certainly inappropriate. Take care, with an exclamation point. I love that. There probably wasn't an exclamation points back in the 1600, 1590 or whenever this 1625. So, but there's one here in this quote. So there you go. Chen has some concerns as well. They say Shi Zhi is contraindicated for patients with damp heat and stagnation. It is also contraindicated in hot diarrhea or early stages of dysenteric disorders. Shi Zhi should be prescribed with caution for pregnant patients. So again, that pregnancy caution is in both. Brandon Wiseman say it is contraindicated in diarrhea or dysentery due to damp heat accumulation in the digestive tract. And it says, I love the way they say it. Bensky said Shi Zhi antagonizes synomomic cortex rogue, while Brown Wiseman says it fears synomomic cortex rogue. So I like the terminology change from antagonize to fear. As mentioned earlier, the American Herbal Products Association's Botanical Safety Handbook does not have an entry on this herb for overall concerns, which I like that book. It's well researched, it's pretty thorough, and it does its job very well. So I'm always disappointed when an herb we have is not in that book. So there we go. We started today by looking at patient charting and some common errors that can occur. Then we looked at the Chinese herb Shi Zhi, Halloysite, or Kaolin. We saw how useful this herb is in treating diarrhea and uterine bleeding. As an astringent herb, it is useful for treating the manifestations or branch conditions, but should be combined with other herbs to treat the underlying or root condition. And we spent a good amount of time discussing its intricacies, including preparations, cautions, and comparisons to other herbs. And with that, we conclude another exploration of a useful Chinese herb. Our next episode, we'll be looking at another traditional Chinese formula, Huanglian Jiaotang, or Coptis and ass hide gelatin decoction. An interesting formula for nourishing yin, treating fire and irritability, and calming the spirit. As always, we will do our deep dive into this formula and look at its traditional uses and its preparation, interactions, and cautions. And, as usual, we will be adding something a little different. It's going to be another interesting expedition into the lesser-known universe of herbs. Please join us. Thank you. And if you like this podcast, please do us a huge favor. Subscribe in your favorite podcast app or give us a 5-star rating. We would love either of those. Thank you very much. And you can get this course as continuing education and get more info on my upcoming integrative nutrition series at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. That's SPERBSHERBS.com. I have here a herb picture color code. If you're wondering why there's all those colors behind the picture, you see the picture, this is what it all means. Just something I put together. And here, as usual, is my bibliography. Thank you very much. Appreciate it.
Spurbs Herbs. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Timothy Dobbins, Roger Campbell,